Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Danish Haziq bin Kamrul Zaman. My matric number is 1192687. Inshallah today, I want to present a part of my research, which is the title, The Use of Quranic Verses and Da'wah Approach in Islamic Treatment, a study of Al-Idrus Islamic Treatment Center, Jalan Jelawat 1, Kuala Lumpur, Malaysia. I'm from my program Bachelor of Dakwah in Islamic Management. My semester 5, 2021. My lecturer is Dr. Mashita Sulaiman. Firstly, my research question. Number 1, how do these Islamic treatment practitioners misuse the holy verses of the Quran which are contrary to the Sharia for their own benefit? Number 2, what is the effect for the society when they are practicing the abuse of the verses Quran in the treatment? And number 3, how to promote da'wah more widely in Islamic treatment in dealing with the misuse of Quranic verses and practice da'wah to patients who are affected by the infidel jinn. Next, my research objective, number 1, to investigate the use of Quranic verses in circles practitioners of Islamic treatment in Malaysia who have been misused for personal gain. The number 2, to explain the effect of the abuse of the holy verses of the Quran in the treatment of society. The number 3, to describe various ways to spread da'wah and increase the promotion of da'wah in Islamic treatment to prevent the issue of misuse of Quranic verses and to preach to patients who are affected by jinn. Okay, we continue to the problem statement. My problem statement. Recently, the issue of misuse of the holy verses of the Quran has become more prevalent in the Muslim community in Malaysia. Some treatment practitioners use the verses of the Quran as a source and treatment. However, through process observation treatment through the verses of the Quran is in accordance with the guidelines of the Quran and Hadith, and some have been abused. Therefore, it can be concluded that the abuse of Quranic verses among practitioners of Islamic treatment in Malaysia occurs in the three aspects, which is as follows. Which is the number 1, Quranic verses are combined with curses that are not understood until mixed and confusing. The number 2, the verses of the Quran are recited in reverse. The recitation starts from the back to the initial verse, which is also used as a recitation of ru'yah or spell to the patient. The number 3, the Quran or its verses are used as amulets that are used as sticks or amulets to repel reinforcements. Okay, what is important of chapter in my research? Important of each chapter, we will know that in this Islamic treatment can also be emphasized the process of da'wah in Islamic treatment and recognize the forms of abuse of verses of the Quran among Islamic treatment who do not follow Islamic law. Therefore, from this study, we need to study about the misuse of Quranic verses among treatment, whether they use the wrong method that does not follow Islamic law with the aim of personal interest, not the intention to help the people of the Prophet sincerely. Inshallah, we go through to the research method. Introduction. In this research, the researcher uses a qualitative method. This method is collecting the data from the participants with asking their questions about the objective research. This chapter includes the research design, data collection, and data analysis. Research design. Research design divided by two categories, which is narrative research, phenomenological research. From this research, the researcher uses narrative research to accomplish the study. This type asking the question to one or more individuals to provide information in this research. Next, the data collection. Due to this study, the researcher collected data from only one participant from an Islamic treatment, namely one of the students from the Al-Idrus Treatment Center. During the interviews, researchers use Google Meet platforms to ask questions. Participants will ask from questions provided by the researcher. In the end, the data will be analyzed and conclusions will be drawn. Data analysis. After the interview process, the researcher will organize and prepare to analyze all the data from the participants. After observing all the data, the researcher will be dividing the data with the categories according to the objective of the study. The data will be described due to what the participant answered. It is a detailed discussion with the multiple perspectives according to the participants. What is benefits from this study? Okay, the importance or benefit of this title is to change the perception of the thinking of the Muslim community about the misuse of Quranic verses in Islamic treatment. For example, the use of Quranic verses on trees or amulets that can repel all evils. In relation to that is shirk for anyone who believes in sticks or amulets that can repel from calamities, because we must ask and pray to Allah subhanahu wa ta'ala, and we only have Allah to submit to Him over everything. Therefore, this study focuses on the emphasis of da'wah to prevent the misuse of Quranic verses and apply the da'wah to patients for healing. For the conclusion, Islamic treatment who want to help patients to ru'yah, these patients need to use the verses of the Quran and the remembrance correctly in terms of proper recitation and intention. In relation to that, at the same time, be able to apply da'wah in treatment also as an example of giving advice and reminders to patients to maintain the practice and most importantly maintain a relationship with God and man. Therefore, the issue of misuse of Quranic verses among the treatment themselves should be prevented and should be given a warning so that ru'yah to patients should be in accordance with Islamic law. Finally, a reminder for all Muslims to take care of themselves and their health because of the disorders of magic, perpetual and santau in this world is very widespread. When affected by magic and so on, it is very difficult to heal unless ruqyah and allowed by Allah to heal, and need to increase practice and multiply the blessings to the Prophet Muhammad sallallahu alaihi wasallam. That's from me. Thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi taala wabarakatuh.